Now, the cool thing about Medicare Advantage plans is when you enroll in one of them, it's actually very easy to use because you end up getting one ID card, your Medicare Advantage plan ID card from your carrier, and all of your A and B benefits are included in that plan, along with any enhancements that they do to your original Medicare benefits. And if it's an MAPD, Medicare Advantage with drug coverage, they're incorporating Part D, and they often offer additional extras, things like vision, dental, hearing, and prescription that are embedded all in one program. So it's incredibly easy to use, but there are some rules that you have to follow, and you need to be aware if your Medicare is assigned to a private insurance company, you're not going to be allowed to use your Medicare card separately. You're going to need to do everything through the plan. Now, many of these plans are available for low or no monthly premium, which is amazing. So the Medicare premium is enough. You have to keep paying for Part B. That's enough to cover the additional benefits, usually without additional cost to you. That can vary depending on where you live, but they're often very low premiums and sometimes none at all. So once it's established that you need to take original Medicare A and B, and you identify the gaps like the lack of prescription drug coverage, deductibles, and coinsurances, the question comes up, what do I get to cover those gaps in original Medicare? And there's essentially two paths that most people go down. One is called Part C, Medicare Advantage. The other is doing original Medicare A and B paired with a supplement and a drug plan. So first I'm going to highlight Part C Medicare Advantage. Now these are private insurance companies that are funded by Medicare and the premiums that you pay. So they're taking the average cost of care in a given area and paying an insurance company directly for your care. Now in order for that to happen, you have to agree that you want to enroll in this private insurance company's plan. And if you're willing to do that, what you're saying is that you're okay with assigning your original Medicare A and B benefits over to a private insurance company. When you're doing that, you're giving up some of your freedom and flexibility of original Medicare, and you're agreeing to use a specific network. Often these plans work with HMOs, generally where you pick one doctor to be your primary care doctor or main doctor, and get referrals to specialists that also work with the plan in the program that you're in. Or sometimes there's some PPOs where you can go in and out of network, but when you go out of network, you're going to share in more of the cost. Medicare Advantage plans are regionally based. Now, every private insurance company that works in the Medicare Advantage space has a contract with Medicare whereby they agree to take care of the patients who enroll in the plan. But what's available from one county to the next can be significantly different. What's offered in now Los Angeles versus San Francisco versus New York City versus Las Vegas are going to be completely different depending on the plans that are filed there, the networks that are established there, and which plans are available. So some areas have more or less plans available, and those options, just because you see them advertised on TV, doesn't necessarily mean they're available in your geography with the carrier that you're looking for. Now, the cool thing about Medicare Advantage plans is when you enroll in one of them, it's actually very easy to use because you end up getting one ID card, your Medicare Advantage plan ID card from your carrier, and all of your A and B benefits are included in that plan, along with any enhancements that they do to your original Medicare benefits. And if it's an MAPD, Medicare Advantage with drug coverage, they're incorporating Part D, and they often offer additional extras, things like vision, dental, hearing, and prescription that are embedded all in one program. So it's incredibly easy to use, but there are some rules that you have to follow, and you need to be aware if your Medicare is assigned to a private insurance company, you're not going to be allowed to use your Medicare card separately. You're going to need to do everything through the plan. Now, many of these plans are available for low or no monthly premium, which is amazing. So the Medicare premium is enough. You have to keep paying for Part B. That's enough to cover the additional benefits, usually without additional cost to you. That can vary depending on where you live, but they're often very low premiums and sometimes none at all. Now, really typical with these plans is you're going to share in some of the costs for services. Those can be co-pays, for instance, to a doctor's visit or to an emergency room. You're going to pay a certain dollar amount. Now, depending on where you live and how good the competition is in your particular area, those co-pays can be more or less depending on the plan. The other thing that all Medicare Advantage plans have is a maximum ceiling out of pocket. So you may recall when we talked about original Medicare Part B, there was no ceiling to the 20% coinsurance you would pay under the Part B program. Medicare Advantage or Part C plans are required to offer a ceiling. Sometimes they're extremely low. I've seen them as low as $300. Sometimes they're very high. I've seen them as high as $8,700 or more per year. So depending on the plan and the package that's put available, those things can be more or less expensive. They typically include a lot of bonus features to entice you into those programs. Things like routine dental benefits, routine vision and glasses, hearing benefits, and prescription are typically included. Sometimes enhancements like over-the-counter benefits, vitamin supplements, first aid can be included in the program, transportation, and more. If you have a special need, an illness, you may be entitled to enhanced benefits like groceries and additional services. So Medicare Advantage plans are very interesting. If you have a plan available in your area that you're happy with the benefits, that works with your doctors, Medicare Advantage could be very well a consideration for you. When you're new to Medicare, you're going to want to evaluate all the doctors that you see and any prescriptions that you take to see if any of the Medicare Advantage Part C plans in your area will work for you. If they do and you're happy with the cost and benefits and you're okay with getting referrals or staying within a certain network, this could be a really nice option for you. Adding or changing Advantage plans is very easy to do. Everyone can change or add Advantage plans every year during what's called the annual election period. It runs October 15th to December 7th each year, and changes made or additions made during this time period are effective January 1st. So it's extremely flexible when you choose a Part C Medicare Advantage plan to make sure that you have coverage each year, and you can change between plans if something comes along that looks like a better fit for your needs and situation, particularly if the plan that you're already on makes some changes for the year. Medicare Advantage can be a great option. You're also eligible to enroll in this plan if you lose employer coverage or if you're new to Medicare. These are all opportunities to choose a Medicare Advantage plan. And the people it works well for, cost is a factor. They're okay with a network and they want a low-cost plan that includes a lot of enhancements. And this can often be a good solution for many people who are looking for those needs to be met. Now, option 2 is what they call original Medicare. And this is the type of option that works better for you if you value the flexibility of using your original Medicare card outside of a set network. You want to be able to see any doctor that takes Medicare. Maybe you have specialists in multiple geographies. Maybe you have 2 homes and you want to be able to see providers in both areas, even if it's not an emergency. In that case, original Medicare paired with a Medigap and a standalone drug plan might be a better fit for your needs and situation. Now, the nice thing about original Medicare with a Medigap is it's extremely flexible. You can see any doctor that takes Medicare. You don't need to get a referral for the insurance purposes. Now, that doesn't mean if you want to see a certain specialist, they might not still request that your doctor order you to see that specialist or to put that in to make that recommendation, but the insurance does not require it in most areas. So original Medicare and a Medigap, you have that flexibility and peace of mind to see any provider you'd like that takes Medicare. Medicare is considered your primary or first insurance. So when you buy this type of option, you're actually using that red, white, and blue Medicare card as your primary insurance. Side by side with that, you're showing your supplemental card, your Plan G, your Plan N, your Plan F. That Medigap card, you're going to show both of them when you're accessing doctor care, when you're going to the hospital, the emergency room, and so forth. Now, that flexibility makes this a very popular option for many Medicare beneficiaries. So why doesn't everybody do it? Well, it can be significantly more expensive depending upon where you live. If you live in a state that guarantees acceptance into these types of plans, you're looking at premiums upwards of $300 per month for someone turning 65. If you live in a state that requires some medical underwriting, the premiums can be lower, but they typically go up as you age, and they go up with inflation, so they can be a lot more expensive. The price range for something like this is more in the neighborhood of a couple $100 a month versus some of those Advantage plans that are at zero cost. So you're getting flexibility, and you may really enjoy that and value that. You're also going to be paying more for that privilege of having access to the full Medicare network. Now, in addition to that, extra services are considered typically a la carte. So Medicare supplement plans are not going to embed prescription drug coverage Part D. You have to buy that as a separate standalone plan. Now, depending on your area, those plans can be more or less money. Depending on the prescriptions you take and your needs, those can cost more, and it is a separate expense. You're also going to have to buy additional benefits like dental, vision, and hearing. Those are going to be a la carte, not embedded in your Medicare supplement with drug coverage plan. So the price of that flexibility can be significant, and you may have to buy these additional services a la carte. You're going to be paying that monthly premium. Now, the nice thing is, depending on the supplemental plan you pick, our most popular one is called Plan G for Great. That plan is going to cover you very fully when you need services. So between A, B, and G, you're covered almost 100% for Medicare covered benefits. The only thing that you're going to pay out of pocket is the Part B 283 deductible. And then if something is specifically an exclusion, like prescription or routine eyewear or cosmetic services, those aren't going to be covered by your Medicare, so therefore they're not going to be covered by your supplemental. But it is possible to get a plan called Plan G that covers just about everything else outside of that Part B deductible. So a minimal share of cost, but a more expensive monthly premium that does go up as you age and goes up with inflation. Now, there also can be enrollment dependencies on these plans. So when you're new to Medicare, absolutely everywhere nationwide, you are going to be covered with guaranteed acceptance into a supplemental, like a Plan G. If you lose employer coverage, you're going to be eligible with guaranteed acceptance into a Plan G. But let's say you first tried a Medicare Advantage plan and then 5 years later decided you didn't like it. Depending upon your state, you might have to go through medical underwriting to qualify for this type of plan. So it's important when you make your initial decision to understand the rules in your area to make sure you're making a decision that meets your needs, not just for the short run, but for the long haul as well. Now, every Medicare beneficiary is entitled to a trial right. If you leave a Medicare supplement to try a Medicare Advantage plan for the first time, or if you're new to Medicare A and B at the same time and try a Medicare Advantage plan, you are eligible for a 12-month trial right, which allows you to get a supplemental within that first 12 months if you decide you don't care for your Medicare Advantage plan for any reason. Outside of that 12 months, if you're not in a guaranteed acceptance state and you don't otherwise qualify, you may have to go through health questions, and based on your answers, the plan can determine your eligibility for their program. So it's really important to decide if this is something that you want and that you value, is that flexibility up front, because if you do, you may want to make that decision right when you become eligible for Medicare. In a nutshell, what I would say is that when you're looking at original Medicare A and B, it's typically not enough coverage altogether. You typically want to add something additional to cover the gaps, the coinsurance, the deductibles, the lack of prescription drug. The two paths that most people go down is A, B, and C, Medicare Advantage. In that plan, you're doing everything all under one program that includes prescription, enhancements, and reduced out-of-pocket costs with a max out-of-pocket ceiling, but uses a specific network and may require you to get referrals to see specialists. Or people will take their original Medicare A and B, use that as their primary insurance, and choose a supplemental like a Plan G that will allow them the flexibility to go to any doctor they choose that takes Medicare and have a very low out-of-pocket cost when they use it, usually the Part B deductible, but you pay for additional services like prescription, vision, dental, a la carte, and you have to pay a higher monthly premium that goes up as you age, as you get inflation increases, and depending upon where you live. So these are things to consider. If you have questions about this, you can always reach us at reservations@blackpointinsurance.com, or you can give us a call, 415-328-0385. We're here for you every step of the way in your Medicare 101 journey to make sure you get all the information you need to make the right decisions for your health care.